Hello, this is Jeremy Beckworth, and this is a talk on diabetes and peripheral neuropathy, an overview. I will be using some information from nutritionfacts.org, so I'm giving them credit, and they do allow for me to share some of their information. The overview of what we'll be covering is diabetes, just generally what it is, the pathophysiology, helpful hints, complications in the current clinical study that we are doing. So an overview of diabetes. So if you had to guess the percent of people in the US who have diabetes or prediabetes, that is actually about 50%. Percent of people with diabetes is 11.6%, and the percent of people with prediabetes is about 38%. So you add that together, about 50% of people have either diabetes or prediabetes, so a very prevalent issue here in the United States. And the percent of people with prediabetes that go on to have diabetes is actually the majority, 70% of people. So it's a very common issue. Type 1 diabetes is an autoimmune issue where the pancreas does not produce enough insulin. There's an attack on the beta cells within the pancreas, and the pancreas loses its ability to produce insulin. Type 2 is different. It was the majority of people who have diabetes have type 2. 90-95% of people with diabetes have type 2. It is insulin resistance within the cell. And so this is a nice overview. This is over about 100 years ago, 1927, an article came out. It was a study where they compared two groups. A group of students were fed either a high-fat diet or a high-carbohydrate diet for 2 days. The high-fat diet received only olive oil, butter, mayonnaise made with egg yolk, and 20% cream. Those fed the carbohydrate diet were allowed sugar, candy, pastry, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. And they did this for 2 days, and then they compared a dextrose tolerance test. They gave them a bolus of sugar, and they see who responded better, who responded worse. So if you had to guess, who do you think did worse? Those who were fed a high-fat diet or those who were fed a high-carbohydrate diet after 2 days? Well, very interestingly, the high-fat group actually did worse. This graph here showing the high-fat group, they had a much higher spike in their glucose than did the high carbohydrate group. So it was a little bit counterintuitive than what most people would think, but going back to 1927, they saw this correlation. The more fat in the diet, the higher the spike was in the glucose. Also very interesting was the fact that the higher the fat intake, the higher the glucose response. There was a dose-related correlation that those individuals taking more fat in had a higher spike in their glucose. So fast forward 100 years, and now insulin resistance is well accepted to be closely linked with fat accumulation in muscle cells. So how does insulin work? Well, the pancreas produces insulin, and that then comes to an insulin receptor on your cells. This is a muscle cell. This is insulin coming to the insulin receptor. It then comes down and it activates enzymes within the cell, which then goes on to open this glucose transport, and from there, this glucose outside the cell will come in the cell, and that will lower your glucose level within the blood vessels. Now, if you have too much fat within the cell, that is called within the myocellular, within the muscle cell lipid, so fat within the muscle cell. If you have that, this is to signify fat, it breaks down or inhibits some of those enzyme reactions that then leads to the inability of the glucose transport to let the glucose come in the cell, which in turn raises glucose levels in the bloodstream. So this is insulin resistance. Now, there are studies that show that fat in the bloodstream leads to insulin resistance, and there is NMR spectroscopy, which looks at fat within the cell that leads to insulin resistance. This has been shown. So even within 1 day, excessive fat leads to decreased insulin sensitivity. And it's been shown even one fatty meal can lead to insulin resistance. Even beyond that, a fatty meal, fat gets within the cell within 2 hours, it peaks within 6 hours, and it's associated with insulin resistance at those times. So within a few hours, and this is another study showing the same thing, that increased fat within about 2.5 hours led to insulin resistance. So these things occur quickly. This was a study looking at overnight IV lipid infusions or fat infusions in adolescents. And as you can see, the before and after fat content within the muscle cells went up, and this correlated with reduction in insulin sensitivity. So just the opposite occurs as well. When you have reduced fat in the bloodstream, it improves insulin sensitivity. So this was a study looking at overnight lowering of free fatty acids, which improved insulin resistance. Interestingly, saturated fat that comes from animal fats appear to be especially bad for insulin resistance. So in general, things that are high in saturated fat, such as butter, have been shown to decrease insulin sensitivity. So how about oil? Is oil bad for insulin sensitivity? When we think of all the oils, olive oil is probably one of the better, has more polyphenols. But as a reminder, oil, 100% of the calories come from fat, and olive oil, even though it's less saturated, it still has 14% saturated fat. Myself and a couple other providers at Advent Health did this little trial where we did 3 days of 4 tablespoons of added olive oil, which is what's been reported in some studies in the Mediterranean type diets. And our glucose levels went from normal beforehand to pre-diabetic, all of us, before to after. And that's prompting us to do a study. We're going to do a study coming up on this very topic. So this was a recent study looking at a plant-based diet with or without added extra virgin olive oil. And when olive oil was added to the plant-based diet, it actually added a bump to the fasting glucose of about 15 points. And going along with what we've just been talking about here, this was a Adventist Health Study 2, 70-some thousand patients in this study, and the prevalence of type 2 diabetes directly correlated with the diets, from a non-vegetarian diet to a semi-vegetarian diet to a pesco-vegetarian diet with fish, lacto-ovo-vegetarian, and vegan. So the more plant-based the diet was, the less the incident of type 2 diabetes. So not only was fat bad for insulin resistance, but it was also bad for beta cell death. And again, the beta cells are the cells within the pancreas that produce insulin, and so increased fat within the diet caused beta cell death. Especially saturated lipids are particularly harmful to the beta cells that produce insulin. So this was a study looking at the 13 years preceding the onset of diabetes, and as you can see, over the preceding 13 years, there was a gradual decline in insulin resistance over that time period. The pancreas was producing more insulin to offset the insulin resistance, but at a specific time, the pancreas started to wear out and lose its ability to produce more insulin. And as fat got into the pancreas, it affected its ability to produce that insulin. Interestingly, beta cell death is particularly more notable in saturated fat, but the predominant fat found in nuts, olives, and avocados did not cause beta cell death. And lowering fat improved insulin resistance and appears to benefit insulin production, so just the opposite. So the less fat, not only beneficial for insulin resistance, but also has benefit with the beta cell function. So what is the cause for type 2 diabetes? Well, we can summarize, as this paper here did, that the cause for type 2 diabetes is a high-calorie diet rich in saturated fats in the setting of unfavorable genetic background. So if you have the genetics and you also have a calorie-rich diet and saturated fat, that is the cause of type 2 diabetes, leading to insulin resistance, but also can injure the pancreas' ability to produce insulin. So the good news for type 2 diabetes, this was a review paper, and the expert commentary was that in the majority or most individuals, within the first 10 years of diagnosis of diabetes, it is reversible. The pancreas is still able to produce insulin, and it is reversible if you can improve the insulin sensitivity. As it gets to be farther out, 8 to 23 years, about 50% of people are able to reverse type 2 diabetes. So again, as an overview of type 2 diabetes, 90 to 95% of diabetes is type 2 diabetes, less common as type 1. It's caused by what? As I've just mentioned, fat within the cell. It affects the enzyme reactions that help open up the glucose transport. It leads to insulin resistance. Fat is bad, particularly saturated fat. And it's not only bad for insulin resistance, but it's also toxic to the beta cells that produce the insulin within the pancreas. And as a review of type 1 diabetes, it is an autoimmune attack on the beta cells within the pancreas, which leads to lack of insulin production. And the question is there any benefit of a whole food plant-based diet in those with type 1 diabetes? The answer is yes, and we will come back to that. So we've talked about an overview of diabetes. Now we're talking a few helpful hints. Helpful hints for diabetes: eat oatmeal, eat beans, and get exercise. So these things all have a beneficial effect. They have a blunting effect on your glucose when you eat these things and you exercise. But not only that day, but subsequent days, there is a benefit. So there's a number of studies that go along with this, even going back to 1909. It says no case of juvenile or adolescent diabetes should be deprived of the benefits of the oatmeal cure. So this is a paper back from 1909. This was a case report of somebody in the ICU with severe insulin resistance diabetes. 2 days of strict oatmeal, that's all they ate. Their insulin needs went down from 205 units down to 42 units. Their glucose normalized from 246 to 104, even with the lower insulin units. So this is just a case report. There's been many others. This is a case series, 15 inpatients with uncontrolled type 2 diabetes. First 2 days, they had a standard diabetic diet, and days 3 and 4, they used oatmeal with cinnamon and herbs were the only extra ingredients. So it was, again, similar to that case report, just strict oatmeal. And the results, insulin needs went down almost in half. So the benefits of this intervention lasted not only immediately, but for several weeks after, as shown by lowered hemoglobin A1C 4 weeks after the intervention. And hemoglobin A1C is a measure over the last 2 to 3 months of how the glucose has been doing. So several studies and reviews of this have highlighted that several of these studies have suggested that effects could last between 4 to 6 weeks after those oatmeal days. So in a systematic review, they looked at what are the benefits of oatmeal, oats, and oatmeal. Well, it lowers hemoglobin A1C, which is a measure, again, over the last 2 to 3 months. It benefits fasting blood glucose. It lowers total cholesterol and LDL. Oatmeal is particularly high in soluble fibers, which acts as a sink or draws cholesterol into the gut and prevents some of it from getting absorbed. So it does a really good job at lowering cholesterol. The component of oats that appears to be beneficial is the beta-glucan, which increases the viscosity of the food bolus, delays the gastric emptying, and slows the absorption of nutrients, especially carbohydrates, and enhances satiety. Additionally, gut bacteria fermentation from fiber leads to anti-inflammatory effects and increases the short-chain fatty acids that are potently anti-inflammatory. As the saying goes, beans good for the heart. Well, actually, they're very much like oatmeal in the fact that they have a blunting effect with your glucose. Not only when you eat them, you can see here there's a blunting effect the meal of, but even it improves second meal tolerance. So even the meal after you eat beans, it has a blunting effect. So you can see here's breakfast, and then there's lunch, and it has a blunting effect. And then you can see again similar at dinner time, and then subsequent breakfast, it has a blunting effect. Exercise very similarly has a blunting effect, not only when you exercise, but even the day after. So helpful hints: eat oatmeal, eat beans, get plenty of exercise. So in summary, a plant-based diet helps diabetes in a number of ways. It decreases the number of medications on average from 4 to 1 in this review. And you can see the hemoglobin A1C being dropped in each individual patient here. And this systematic review and meta-analysis suggests that the consumption of vegetarian diets is associated with improved glycemic control in type 2 diabetics. So the question is, can type 1 or type 2 be reversed? Well, type 2 can be reversed, but are there any benefits of a whole food plant-based diet for type 1 diabetics? And the answer is yes, as you look at the complications. So if you look at the top causes of death in diabetes, whether type 1 or type 2, the top cause would be cardiovascular disease, heart attacks and strokes. And this is a published image out of the Cleveland Clinic, Dr. Esselstyn, showing that yes, you can improve vascular flow. This is coronary arteries, the arteries around the heart, with dietary changes. You can improve that with dietary changes. And so while you can't fix type 1 diabetes, you can improve the complications that are associated with type 1 diabetes. The number one being cardiovascular risk. And most all of the underlying complications with both type 1 and type 2 diabetes is of underlying vascular issues. Again, cardiovascular disease, kidney disease is common in those with diabetes. But again, if you get better blood flow to the kidneys, we think that is an underlying culprit with kidney function issues. Retinopathy, damage to the blood vessels in the retina, the eye, that can lead to vision loss, becomes common. 20% of people with type 1 diabetes after 20 years develop this. 60% of those with type 2 after 20 years. Again, it's a vascular issue. Neuropathy, like painful neuropathy, 50% of people with diabetes after 10 years get a peripheral neuropathy. And the underlying cause of that, many studies have shown, is poor blood flow to the nerves in the feet. High blood pressure, cholesterol, peripheral artery disease, foot ulcers. At a baseline, again, the underlying issue is poor blood flow. And I would encourage you, if you go to the YouTube page MedInfo Lifestyle Medicine, and look at the story of Sarah. She has type 1 diabetes, and she went on a plant-based diet. Her need for insulin was cut in half. Although she had type 1 diabetes, her pancreas was not producing any insulin. Her need for insulin was cut in half because her insulin sensitivity improved going on a plant-based diet, and it really stabilized her. She had really brittle, uncontrolled diabetes until she changed her diet. So she has a powerful testimony I'd encourage you to watch. This is a case series looking at kidney function from before switching to a plant-based diet and then after, where you can see the kidney function either leveled off and in some people actually improved. So diabetic neuropathy is seen in about 30 to 50% of people with diabetes with time. And what is the cause of diabetic neuropathy? I mentioned that earlier. The underlying cause is poor blood flow, the microcirculation to the nerves in the feet, and with time it can march up the legs and even get into the hands. So the underlying issue is poor blood flow, the microcirculation, and many studies have shown that. Here's another one showing nerve biopsies correlating with neuropathy, with poor blood flow. And another study, again, highlighting the same thing, vascular factors associated with diabetic neuropathy. So the treatment for painful diabetic neuropathy currently, like standard, would be things like medications such as anti-epileptic drugs like gabapentin or pregabalin, antidepressants. There's a few different classes, the SNRIs or the tricyclic antidepressants, which do help, but they're more of a marginal benefit. And the most common of the medications being used are the gabapentins and pregabalin type medications. And an average, if you look at their big reviews, the average reduction in pain with gabapentin or pregabalin is about 2 points, and placebo drops about 1 point. So it's helpful, but man, it's more of a marginal benefit. Lyrica, at the higher doses, you can get a little bit more of a drop in pain, but this study showed that 77% of people who were prescribed pregabalin will discontinue it within a year due to side effects or lack of efficacy. The more common side effects with medications like gabapentin and pregabalin, which is Lyrica, would be dizziness, drowsiness, and swelling in the ankles. So at the higher doses, about 7% of people will get that. It's less common at the lower doses. Weight gain is possible, especially more at the higher doses. And with the antidepressants, the SNRIs, serotonin norepinephrine reuptake inhibitors, the one that is actually FDA approved for diabetic peripheral neuropathy is duloxetine, but there's a few of them, venlafaxine, Pristiq, Savella, and a new one, Fatzima. And the studies for duloxetine, there can be some improvement of pain, again, probably in the 2 to 3 point range, but there are potential side effects as well. With the antidepressants, GI side effects like nausea is common. It does increase norepinephrine, which has the potential to raise your blood pressure. Sexual side effects like decreased libido or erectile dysfunction is seen in about 50% of people using these medications. Similar with the older antidepressants, the TCAs, the tricyclic antidepressants, can have some sedation, cognitive slowing. They have an anticholinergic effect, and there's some potential also for sexual side effects. There are things like spinal cord stimulators. This is that are used for diabetic peripheral neuropathy. They can be effective, but there's only 2-year follow-up on these, and there is a potential downside. You can have pain at the battery side. It's an implantable surgical procedure, and the risk of infections are not insignificant. And how long will it last? Beyond 2 years, we don't know, and sometimes these do have a waning effect over time. So are there any other options besides medications or more invasive surgical implants? Well, again, if you asked Google or AI, can you reverse diabetic neuropathy? The answer is no. There's no cure for diabetic neuropathy. If you ask providers, we're taught, no, there's not really. You can help manage it, keep your diabetes in control, and there's medications and such. But there was actually a study back in 1994, not well known, that showed regression of diabetic neuropathy with a total vegetarian or vegan diet. And this was a live-in program, Crane and Sample were the authors, 21 patients in a 25-day live-in lifestyle medicine program. 17 of 21, so about 3/4 of people, had reversal of their painful diabetic neuropathy within 16 days. Numbness persisted but notably improved during the 25-day live-in program, and follow-up was maintained 1 to 4 years in these 17 patients, with 71% of them remaining on the program, and they continue to have improvement in the vast majority of them. So what did they do in this study? It was a plant-based diet, meaning there's no meat, whether red meat or white meat, no dairy, no eggs, no oil, no butter, no sugar or meat substitutes. They were allowed nuts, olives, and avocados as long as their weight was optimal for height, according to the paper, and exercise was encouraged at least 30 minutes a day or 2 miles a day of walking. So that was what they did. And there's another case or series that's referenced, but it was never actually published, which shows similar results. So the commentary on these 2 studies was that the pain improved much more quickly than did the glucose control. So it had to be something beyond the glucose that got the neuropathy better. And the suggestion was it was likely better vascular improvement, the better blood flow. And again, if you look at those studies out of the Cleveland Clinic with Dr. Esselstyn, within a few weeks, the blood flow around the heart improved on those nuclear medicine stress tests. So can vascular disease really be improved? Yes. 82% of people had reversal or improvement on repeat imaging in California, and 99% of people did better there at the Cleveland Clinic. Again, this was with coronary artery disease, but it's the same process, arterial flow, but this specifically to the nerves in the feet. So there has been one randomized controlled trial looking at painful diabetic neuropathy, randomized controlled trial looking at a plant-based diet. And this was a 20-week study, 30 randomized patients. They were either randomized into a low-fat plant-based diet with weekly classes for support and added B12. They limited the fat to 20 to 30 grams a day, which is equivalent to 2 tablespoons of olive oil or 1 avocado. They didn't specifically say what they couldn't have, just other than it was a low-fat diet limited to that. The control group had B12 supplements, but otherwise did not change their diet. And they did see in the treatment arm an improvement in the McGill Pain Questionnaire of a drop of 9.1 versus 0.9, which is considered clinically significant. That's a 5-point change is considered clinically significant on this McGill Pain Questionnaire. There's a couple other studies that were not, a couple other outcomes that were not quite as impressive. With the Michigan Neuropathy Screening Instrument had a slight change. The pain scores really were not, actually the control group did better than the intervention. So a 1.2 drop in the diet group versus a 2.0 drop in the control group on a 10-point scale. So really it was not as impressive. So why a difference? In the Crane and sample study, 3/4 of people had the pain essentially gone within 16 days, whereas in this more recent study I mentioned, one of the questionnaires did have improvement, but the majority of the questionnaires really there was not as marked an improvement. And they had a low-fat diet, which was characterized as a 20 to 30 gram per day of fat, which is low fat, but they didn't say they excluded specific things like butter and oil and so forth. It wasn't exactly outlined in the paper. So that may be part of the explanation. So in our clinical study, we have interim results that are being presented in August 2026 at the International Conference for Nutrition and Medicine in Washington, D.C., Dr. Neil Barnard's group. And our study is a 2-month study, randomized trial, either diet, a plant-based diet versus medical management. After 2 months, the medical management group can cross over into the diet group. So our current study is a whole food plant-based diet, meaning no meat, no red meat or white meat, no fish or chicken included in there. So if it has a face or a mother, it is out. No dairy or eggs, no oil. So we think that's a big difference with that prior study that didn't show much improvement, where the first one showed marked improvement. Nuts are allowed. 1/4 cup a day, about a palmful is okay. 1 avocado a week is okay. And why are we doing no oil? So the rationale here, besides those 2 studies I mentioned, one seemed to showed improvement, the other did not show as much improvement. The only study showing improvement of vascular disease around the heart is when they did a plant-based diet and excluded oil, both at the Cleveland Clinic and in California. And you can see these are images I showed before, but a narrowed artery opening up. This is over 32 months, and this is a stress test, lack of blood flow in the part of the heart muscle, getting improved blood flow within 3 weeks. And they've actually noted within 2 to 3 weeks, people doing much better with arterial flow. A more recent study, 2024, took people who put them on a plant-based diet. When they added olive oil into the diet, it increased the total cholesterol by 29 points, which you can see down here, bottom left, increased total cholesterol by 29 points. The LDL bad cholesterol bumped up by 16 points when they added it, and the glucose increased by 15 points. So again, while oil is probably not the worst thing ever, from a vascular flow perspective and for diabetes is probably not the best. And a couple other studies, one showed olive oil decreased arteries' ability to dilate by 31%. And then the PREDIMED study, which is one of the big Mediterranean diet studies, showed worsening of carotid arteries with olive oil. As you can see here, this middle line is Mediterranean diet with extra virgin olive oil. And under ultrasound, it actually worsened the thickness of the carotid arteries, more calcification, or narrowing of the artery, I should say. So, can you reverse diabetic neuropathy? Again, if you ask Google or AI, they'll say no, there's no cure for diabetic neuropathy. But here are our results thus far. And you can see this, the orange line here is the medical management with medications, like the gabapentins, Lyricas, Cymbalta, those type of medications, versus the diet group. Within 2 weeks, we're seeing marked improvement, pain going from a 6 to 7 down to about a 1.5, with some steady improvement over 2 months. And clear clinical significance, but also statistically, you can see the confidence intervals do not overlap even out 2 weeks. And in this study, those getting 50% relief of pain, the diet intervention is the blue line, blue bar, and by 4 weeks, 100% of individuals were getting at least 50% reduction in their pain. And those getting 75% reduction in the pain, if you come out here to 2 months, 86% of individuals in the diet intervention had at least 75% improvement of their pain. So the biggest risk with this study is that it works so well that it lowers your sugar to a dangerous level. You become hypoglycemic, and that can be very dangerous if your sugars drop too low. So if you're on insulin or you're on specific diabetic medications that can lower your sugars too low, you want to be very cautious with that because that can be dangerous. So an overview of everything we've chatted about here. Diabetes type 1 is an autoimmune issue where the pancreas is not producing enough insulin. Type 2 is caused by insulin resistance, And what causes that insulin resistance? But fat within the muscle cells leads to insulin resistance. And over time, as fat gets into the pancreas, there's less insulin production. Helpful hints, it's helpful to eat oatmeal and beans. Those have a blunting effect, not only when you eat them, but even after the effect. Same with exercise. It lowers your glucose level, not only when you exercise, but it has an effect even afterwards. The major complications from diabetes is strongly linked to vascular causes, as we mentioned. And diabetic neuropathy, we're doing a study on that. It is treatable through nutrition. I would encourage you to check out the YouTube page MedInfo Lifestyle Medicine and check out some of the testimonies of patients who've been in this study. But thank you so much for your time.